Hi, Paul Grandma fans. Welcome to my channel. Thanks for joining me today. Please remember to hit like and subscribe and hit that notification bell if you want to be notified when I update any videos, when I upload, sorry. Um, Today I'd like to just talk a little bit about stuff that's going on with me. I've been having, I was diagnosed with lupus, incomplete lupus erythematosus, or ILE is what my rheumatologist called it. And a couple years back, I talked about, at the very end of one of my videos, I talked about it, going to see a rheumatologist. I changed my rheumatologist to be my primary care physician. And for 2 years, I was seeing him as my primary care, and he wouldn't ever bring in a laptop or a chart or anything. He would come in and say, "Oh, so well, what are you here for today?" And I would mention labs, and the only time he would actually even discuss labs with me is when I had a question about results, and we would go into his office and he'd pull it up on the computer. And I think if he had been looking at them all along, like if he had my chart or something, he would notice that my labs have been consistently off every time. Most specifically, it's been my creatinine and my EGFR, which both are indications of kidney disease or kidney failure. Now, I have been at the same levels for, like I said, 2 years. And I finally switched primary care doctors. The beginning of this year, I started going to a new one, and he's ordered some labs and urine tests on me to determine kidney function. I found out from his progress notes on my chart, that these tests are to determine if I am at 3A or 3B kidney disease or kidney failure. 3B is when they send you to a nephrologist, a kidney doctor. My friend says it sounds like I have lupus nephritis. She has lupus also, but I'm not sure if that's it, or the hydroxychloroquine that I'm now taking may be contributing to kidney disease. I read about that, and it can contribute to worsening kidney disease. So I'm in limbo until Thursday. I go back to see him. I had my blood drawn today. I had to go 4 places, 2 in my right arm, 1 in my left arm. Let's see if I can get a good picture of that, because as she was drawing it, it was bruising. So let's see if I can get a picture. Oh yeah, that's beautiful. Yeah, that's beautiful. And then one lady got it in my hand. She had to call someone else in, and they actually got it out of my hand, in my right hand. My urine output, I know this is going to sound gross to people, but my urine output has been quite low. And even over an hour of chugging water, I could only give them a dribble sample. I hope it's enough. If it's not, I'll be going back in. But I find these results out. I can actually probably look up the results tomorrow or Wednesday and get my results from Quest. I guess I'm supposed to go for a chest x-ray. He had mentioned a chest CT, but then mentioned a chest x-ray just to make sure I don't have lung cancer. I'm just like, Okay, whatever. Chest x-ray cost me like 25 bucks. Big deal. So I didn't know he scheduled me. He wanted a chest x-ray done at RMI. I guess I'll be going to RMI tomorrow to get a chest x-ray done. So in the meanwhile, he's also checking my liver enzymes because I have been previously diagnosed with autoimmune hepatitis. I had a liver steatoma, and I went to a gastric doctor for it, and he just said to have let my rheumatologist take care of the lupus. I don't think my liver enzymes have been very bad since I've been on the medication, hydroxychloroquine. I take 200 twice a day. But my kidney function is what I first discussed with my primary care, because essentially the kidneys are the most important thing. If the kidneys go, the rest of your functions go. And I need to know if I got to be going to a kidney doctor or not. So that's where I'm standing at this point. All this blood work, urine. I'd previously had ketones in my urine. I've had proteins. So the stuff's kind of important to me. I have so many other medical issues to talk to him about, but I don't want to overwhelm him. So we started off with the kidney function and the liver function. So, he did a whole CBC, metabolic panel, all that. And I guess I'll see maybe tomorrow what the results come out. I may update you before I see the doctor because I'm going to know the results. And what he's going to tell me is not going to be anything new. So, I might just come on with the results and tell everybody, because, it's not looking good. If you go 60 or higher on the EGFR, is 60L or higher, like 61 or 62, that's definitely 3B kidney disease. And I was alerted by my HAP nurse that comes around once a year. She looked at my labs, and Amy, thank God for Amy. She looked at my labs and she said, you're in 3A kidney disease, kidney failure. I'm like, what? And she said, yeah. I said, my doctor hasn't even looked at him then, because he hasn't said anything. So that's what started me on. I went to the doctor the last time. I went to him maybe October for refills, and I asked him, how do I know that the hydroxychloroquine is working? And he said, oh, your labs will show. Okay, so my labs are showing it's not working, or it's doing something else to my organs. But I really think the kind of lupus that I have is internal, organ affecting type of lupus, because I don't have the pain normally associated with lupus. I don't have the pain in the joints. I know I have Raynaud's disease, where my hands and feet are always cold. I know I have a couple other things that are autoimmune. And I have like maybe 3 out of 4 of the markers for lupus. So it's considered incomplete lupus. And it's not SLS, it's SLE. ILE in my case. My doctor wrote down SLS. I'll have to correct him on that. But yes. So I'm not sure what's going on. Ever since I was in the hospital with pneumonia in October of 19, I all of a sudden had thyroid disease, kidney, liver disease. I take so many pills now that it's like, I don't want to be on these pills. Just figure out what's wrong with me and give me one pill for everything. I know that's not possible, but he's lowered my Flexeril to 2 times a day, which is fine because I've only been taking it 2 times a day anyway. I was just enjoying having the extras for just in case. But now I don't have that option. And I have also cut my gabapentin to twice a day, so I'm at 1,200 a day. And I go back to my spinal cord stimulator doctor on Friday down in Royal Oak, and hopefully at that point we will have a set program. I'm currently working on the 4th program, the last one, and I have a lot of breakthrough pain still. So, but I can't go higher in the percentage. Like I'm set at 70%. My trial was set at 84% or 85, something like that. And it worked perfect. But now if I go over 70% now, I get too tingly. My legs get really tingly and I know it's just too high. So hopefully when I go down there, we'll get it set. We'll get it set straight on the right program, and hopefully I'll be able to start reducing that gabapentin down and cut my pills in half, take, half twice a day, and that would make it 600. Or maybe go 300 and then 600, just to cut it down slower. That might work, but I need to get off this gabapentin because my brain scans haven't shown that I have any issue, except I have white matter in the gray areas, which everybody says is a tribute to my age and that I smoke, I guess. But that's, I don't know. I kind of have a feeling I had a stroke in my first surgery in 2016. The doctor never told me about, because ever since then, my brain doesn't work right. And I can't get a job if my brain's not working right. I can't learn anything new if my brain's not working right. I'd love to get another job. I'm only 54. I could still work if I could use my brain. So anyway, that's a talk for another matter. That might be my next discussion with my new primary care doctor. And I don't think I'm going to go back to Dr. Aljaban as my rheumatologist, because he's just, if I can't trust him to keep track of my labs when they're bad, then how can he keep track of my lupus? It just doesn't, I can't do it. And so now I'm going to ask to see a new rheumatologist. I need to see a neurologist because of the brain issue. And so, I don't know, we'll go from there. I'll find out my labs. Maybe I'll cut you guys in on the labs. Or maybe I'll just wait till I see the doctor and what he says about the labs. I'll try to record him if he'll let me record him. I don't know. He's new to their practice, I guess. And so his name's not on anything. Even my lab work had Dr. Ahmed's name on it. So anyhow, I hope everybody has a blessed week and enjoy life. And Bug Grandma out. Peace out.